Have you ever left your doctor's appointment and thought, what did they just say? Well, you're not alone. Today we're going to talk about health literacy and why it could be one of the most important skills you'll ever have. Now, what is health literacy? The NIH defines it as the degree to which individuals have the ability to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. But all of those words just mean, how well can you find, understand, and use health information? It's knowing what your prescription label means, understanding your test results, navigating the healthcare system, and even figuring out the right questions to ask your doctor. With good health literacy, you can make better decisions about your care, follow treatment plans correctly, and avoid preventable problems. Without it, it's easy to get lost in the maze of medical terms, instructions, and forms. But let's get to the core of why it matters. Health literacy gives you the language, confidence, and tool belt to advocate for yourself in the crazy world that is the healthcare system. Healthcare is not an easy place to navigate, but it does not mean you should avoid going to the doctor. It means you go prepared. You know your questions, you understand your options, and you speak up when something doesn't make sense. It means you recognize that your voice matters in decisions about your body and your treatment. With strong health literacy, you're not just a passenger in the healthcare system, you're in the driver's seat. And that's how you get care that truly works for you. Here are some of the things I recommend doing to build up your health literacy. The first is ask questions, and don't just stop at the first answer. Use the Ask Me 3 approach. What's my main problem? What do I need to do? And why is it important for me to do this? Ask for explanations in plain language and not just medical jargon. The second is write things down or record them. You can bring a notebook to appointments or use your phone to jot key points so you don't forget. This is really important so when you get home, you know exactly what to do and what your next steps are. The third one is research using reputable sources. Look things up for clarification, but don't forget to stick to trusted health websites like the CDC, Mayo Clinic, NIH, or your local health department, and avoid random forums for medical advice. The fourth is to learn to read and interpret basic health information. Practice reading prescription labels, lab reports, and appointment summaries. Familiarize yourself with common terms related to your conditions too. The fifth is bring support. Take a family member or friend to help listen, take notes, and ask questions you might forget if you don't feel comfortable doing that yourself. The sixth is follow up after your appointments. Call your provider if you realize later you didn't understand something. It's better to clarify than to guess. Practice healthy skepticism. Compare information from multiple credible sources before making a health decision. That's really important that you know all your options. Know your own medical background. Keep track of your medications, allergies, family health history, and past test results. This will make your conversations with providers easier and a lot more accurate. Think of health literacy as your health superpower. The more you understand, the more control you have over your own well-being.